What is Hwalbeop, Korean traditional martial arts therapy? Hello, dear listeners. Today, we have prepared a truly special time. We will take time to learn together about Hwalbeop, which is a precious cultural heritage of our country, but may still be unfamiliar to many of you. Have you ever heard the terms Hwalbeop or Dongbang Hwalbeop? Most of you are probably hearing these words for the first time. However, this Hwalbeop is a very scientific and systematic healing method that our ancestors have developed over thousands of years. And Dongbang Hwalbeop is a name newly created by those who systematically modernized this healing technique, and it was created to emphasize that it is a technique originating from Korea. Currently, various treatments using the name Hwalbeop are proliferating in the medical market, but most of these lack the philosophical foundation and technical depth of true Dongbang Hwalbeop and are merely being used as tools for commercial branding. This phenomenon is clearly epistemological appropriation from an academic perspective, and it is a serious problem that damages the essential value of traditional knowledge systems. This audiobook aims to clearly identify the ontological identity of Dongbang Hwalbeop and academically criticize the current widespread misuse and abuse, thereby restoring the true value of this unique traditional medical system. In particular, it will objectively analyze the level differences among practitioners and clearly establish the boundaries of true Hwalbeop through its inseparable relationship with Hwalgido martial arts. Today, I want to take a long journey with you into the world of this amazing healing method. Through today's broadcast, you will learn in detail about what Dongbang Hwalbeop is, what principles it operates on, and how it can be utilized in modern society. Please listen with a comfortable mind. Chapter 1. What is Hwalbeop? Dongbang. Hwalbeop is a unique traditional medical system that has developed on the Korean peninsula for thousands of years. It is not merely a collection of treatment techniques, but presents a completely new medical paradigm based on Qi philosophy. Unlike Western reductionist medicine that approaches diseases partially, Hwalbeop views humans as one complete energy system and pursues holistic treatment. The core of Hwalbeop is inseparably connected with Hwalgido martial arts. This is not merely a historical association, but an ontological necessity. The Qi sensitivity and energy control abilities developed only through martial arts training are prerequisites for true Hwalbeop treatment. Many treatments currently performed under the name of Hwalbeop in the medical field lack this martial arts foundation, and therefore cannot be considered true Hwalbeop. The theoretical foundation of Hwalbeop lies in Qi philosophy. Qi is not merely a metaphor for energy, but a real existence that penetrates matter and spirit. When compared to modern physics quantum field theory, Qi shows characteristics similar to quantum fields that have the duality of particles and waves. Within the human body, there exists an energy circulation system called the 12 meridians and the 8 extraordinary vessels. These are not simple anatomical structures, but energy maps that visualize the circulation and transformation of Qi. Each meridian represents a specific functional system, and their interactions show characteristics similar to the emergent properties concept in complex systems theory. A healthy state is when this energy circulates smoothly, and disease is an imbalanced state of energy stagnation, reflux, dissipation, or depletion. Hwalbeop achieves fundamental healing by accurately diagnosing and correcting these energy imbalances. Furthermore, Hwalbeop classifies the pathological states of the human body into 8 knots, gayol. Knots refer to pathological states of energy, which is a completely different paradigm from Western medicine's symptom-based classification. The formation process of each knot can be understood from the perspective of chaos theory. Just as small differences in initial conditions create large changes over time, minute energy imbalances gradually expand to form clear pathological patterns. Diagnosis of knots is made through palpation, pulse diagnosis, and observation. Skilled Hwalbeop practitioners can directly sense the flow and stagnation of energy through the patient's body. This is a highly developed sensory ability acquired through long martial arts training. Most importantly, martial arts training in Hwalgido is essential for properly understanding and practicing Hwalbeop. This is not an option, but an ontological necessity. The internal energy and chi sensitivity acquired through martial arts training are prerequisites for Hwalbeop treatment. The abilities developed through martial arts training include: first, developing proprioceptive sensitivity to detect minute changes in one's own body. Second, developing kinesthetic intelligence to distinguish the quality of movement and energy. Third, cultivating the ability to control qi through intention. Fourth, acquiring mental stability and concentration necessary during the treatment process. And fifth, mastering the ability to sense others' energy states. Currently, some techniques of Hwalbeop are being used in traditional Korean medicine, physical therapy, and chiropractic fields, but they all lack the martial arts foundation. Therefore, what they practice is merely superficial imitation of Hwalbeop, and is not true Hwalbeop in the genuine sense. Chapter 2. Diseases treatable with Hwalbeop. 1. Musculoskeletal disorders. Hwalbeop shows excellent effects on musculoskeletal disorders. Going beyond simple muscle relaxation or joint correction, it achieves fundamental healing through whole body energy balance. Spinal disorders. Spinal conditions such as disc problems, spinal stenosis, and scoliosis are major treatment areas of Hwalbeop. Hwalbeop doesn't view these simply as bone and muscle problems, but approaches them as whole body energy imbalances. It particularly improves circulation of the governing vessel and conception vessel to induce natural spinal alignment. Arthritis. Joint diseases such as degenerative arthritis and rheumatoid arthritis are also effectively treated. By improving qi and blood circulation around joints and resolving energy stagnation that causes inflammation, it relieves pain and restores joint function. Muscle disorders. Chronic muscle conditions such as myofascial pain syndrome and fibromyalgia are also specialty areas of Hwalbeop. It accurately locates and resolves nodal points within muscles and restores whole body muscle balance. Second, internal medicine disorders. Hwalbeop shows remarkable effects in internal medicine as well. By harmonizing organ functions and optimizing whole body energy circulation, it maximizes natural healing power. Digestive disorders. Digestive conditions such as gastritis, peptic ulcers, irritable bowel syndrome, and chronic constipation are major treatment targets of Hwalbeop. It strengthens spleen and stomach functions and normalizes gastrointestinal motility. Respiratory disorders. Respiratory conditions such as asthma, chronic bronchitis, and allergic rhinitis are also effectively treated. It restores lung qi's dispersing and descending functions and strengthens immunity. Circulatory disorders. Circulatory conditions such as hypertension, arrhythmia, and angina are treated through heart-qi harmonization. It normalizes cardiovascular autonomic nervous system function and improves blood circulation. Endocrine disorders. Endocrine conditions such as diabetes, thyroid diseases, and adrenal fatigue syndrome are also treatment areas of Hwalbeop. It strengthens kidney qi and restores whole body hormonal balance. Third, neuropsychiatric disorders. Neuropsychiatric disorders that are rapidly increasing in modern society are areas where Hwalbeop's unique strengths are demonstrated. It treats both body and mind simultaneously from the perspective of mind-body unity. Depression and anxiety disorders. Hwalbeop shows remarkable effects on treatment-resistant depression or anxiety disorders that are difficult to resolve with modern psychiatry. It finds emotional stability by improving the complex state of heart, qi deficiency, and liver qi stagnation. Sleep disorders. Sleep disorders such as insomnia and sleep apnea are diagnosed as kidney yin deficiency with fire flaring upward or heart-kidney non-interaction. It finds natural sleep rhythm by restoring yin-yang balance. Headaches and migraines. Chronic headaches and migraines are among the conditions difficult to resolve with modern medicine. Hwalbeop provides fundamental treatment by regulating excess yang qi, rising to the head, and insufficient yin qi descending downward. Autonomic nervous system. Dysfunction, autonomic nervous system imbalance due to chronic stress in modern people is a specialty area of Hwalbeop. It maintains whole body homeostasis by restoring balance between sympathetic and parasympathetic nervous systems. Fourth, gynecological disorders. Hwalbeop's gynecological treatment, considering women's physiological characteristics, is very effective. It treats by accurately understanding women's qi and blood circulation characteristics, menstrual irregularities and dysmenorrhea. Menstrual cycle irregularities and menstrual pain are diagnosed as dysfunction of the penetrating vessel and conception vessel. It normalizes women's reproductive functions through harmonization of these 8 extraordinary vessels. Menopause syndrome. Menopausal symptoms due to hormonal changes appear as a complex state of kidney yin deficiency and liver yang rising. Hwalbeop delicately regulates this yin-yang imbalance. Infertility. In cases of unexplained infertility where modern medicine cannot find the cause, Hwalbeop optimizes whole-body energy circulation to increase pregnancy possibilities. Fifth, pediatric disorders. Children's diseases require a different approach from adults. Hwalbeop's pediatric treatment, considering the characteristics of growing bodies, is very effective. Growth disorders. When children are short or have delayed development, it is diagnosed as kidney essence deficiency and treated. It activates growth plates and promotes growth hormone secretion. Pediatric asthma. Children's asthma is diagnosed as lung-spleen deficiency. It strengthens lung and spleen functions to enhance immunity and alleviate bronchial hypersensitivity. Attention deficit hyperactivity disorder. ADHD. ADHD, rapidly increasing in modern society, is diagnosed as heart-spirit restlessness. It stabilizes the mind and improves concentration. Nocturnal enuresis. Pediatric nocturnal enuresis is diagnosed as bladder control ability deficiency due to kidney qi weakness. It strengthens kidney function to naturally stop bedwetting. Chapter 3. Characteristics of modern society. Diseases and Hwalbeop's superiority. Modern society's health problems are mostly related to energy circulation disorders. New forms of diseases are appearing due to digital civilization, environmental pollution, and increased stress. 1. Digital fatigue syndrome. Complex symptoms due to excessive use of digital devices are a state of upper heat and lower cold, where upper burner qi rises excessively and lower burner qi becomes insufficient. This is a systemic energy imbalance beyond simple neck and shoulder muscle tension. 2. Chronic stress disorders. Modern people's chronic stress is a state where liver qi stagnation and heart-spirit restlessness appear in combination. This is a complex pathological state that is difficult to address appropriately with Western medicine's symptom-based approach. 3. Environmental toxin accumulation. Various chemical substances and heavy metals in modern society weaken liver and kidney functions responsible for the body's detoxification. This manifests as various symptoms such as chronic fatigue, decreased immunity, and increased allergies. Hwalbeop finds and corrects energy imbalances that are the fundamental causes of symptom manifestation. In cases of hypertension, rather than simply lowering blood pressure, it resolves the energy imbalances causing blood pressure elevation. Through this, blood pressure naturally normalizes and doesn't recur. Furthermore, Hwalbeop is a method of activating the body's natural healing power. Rather than artificially introducing external substances, it restores the body's inherent healing abilities. Therefore, there are no side effects, and overall health status actually improves. And Hwalbeop restores whole body balance through a holistic approach. It considers the impact of one part's problem on the whole and solves partial problems through overall harmony. This brings more fundamental and lasting therapeutic effects. Most diseases classified as incurable in modern medicine are due to serious disorders in energy circulation. While these diseases are difficult to find solutions for through Western medicine's analytical approach, they have treatment possibilities through Hwalbeop's holistic energy approach. In that sense, let's examine the following diseases in more detail. First, autoimmune diseases. Autoimmune diseases such as rheumatoid arthritis, lupus, and Crohn's disease are conditions manifesting from immune system confusion. Western medicine uses immunosuppressants to suppress symptoms, but this is not a fundamental solution. In Hwalbeop, autoimmune diseases are diagnosed as a complex state of righteous qi deficiency and pathogenic qi invasion. It restores immune system balance by strengthening righteous qi and eliminating pathogenic qi. Particularly, it normalizes immune function by strengthening kidney essence and fortifying spleen qi. Second, degenerative brain diseases. Degenerative brain diseases such as Alzheimer's disease and Parkinson's disease are among the most difficult conditions in modern medicine. There are no effective treatments to prevent brain cell degeneration. In Hwalbeop, these diseases are diagnosed as kidney essence deficiency and water not nourishing fire. It promotes brain cell regeneration and inhibits degeneration by strengthening kidney essence and improving energy supply to the brain. And third, cancer. Cancer is a disease difficult to completely cure, even with modern medicine's three major treatment methods: surgery, radiation, and chemotherapy. Normal cells are often damaged during treatment, worsening patients' overall health status. In Hwalbeop, cancer is diagnosed as righteous qi weakness and accumulation of pathological products such as blood stasis and phlegm. It strengthens natural immunity by reinforcing righteous qi and improves the cancer cell growth environment by removing pathological products. It also maximizes natural healing power by improving whole body energy circulation. Chapter 4. Actual Hwalbeop treatment and process. Hwalbeop diagnosis is conducted in a completely different way from Western medicine examinations. It doesn't rely on machines or test values, but directly grasps the patient's energy state through the practitioner's senses and experience. 1. Observational diagnosis. It grasps overall health status and constitution through the patient's facial color, body type, posture, gait, etc. Skilled Hwalbeop practitioners can obtain much information from the moment a patient enters the treatment room. 2. Pulse diagnosis. It diagnoses the state of organs and qi blood circulation through wrist pulse. Hwalbeop pulse diagnosis doesn't merely look at pulse speed or intensity, but makes detailed diagnoses through 28 pulse conditions. 3. Palpation and not diagnosis. By directly touching the patient's body, it grasps muscle tension, temperature, humidity, etc., and accurately diagnoses the location and condition of the 8 knots. This requires highly developed tactile abilities that can only be developed through long martial arts training. Fourth inquiry. It asks in detail about the patient's symptoms, lifestyle habits, emotional state, etc. Particularly, it grasps when and in what situations symptoms worsen or improve to find patterns of energy imbalance. Regarding treatment methods, Hwalbeop treatment must be performed through manual therapy using hands. Even the highest level practitioners cannot treat without touching with hands. This is an essential characteristic of Hwalbeop, and claiming to treat without touching hands is fraudulent. Treatment methods can be classified as follows. First, knot resolution method. It sequentially resolves the 8 knots discovered through diagnosis. Each knot has special techniques, and practitioners press with accurate direction and intensity to release energy stagnation. Second, meridian communication method. It opens blocked meridians to make qi blood circulation smooth. It restores whole body energy balance by improving circulation of the 12 meridians and 8 extraordinary vessels. Third, yin-yang harmonization method. It balances yin-yang of upper-lower, left-right, exterior-interior. It brings overall harmony by descending excessively risen yang qi and supplementing insufficient yin qi. And fourth, 5 organs and 6 bowels. Regulation method. It optimizes each organ's function. It restores natural balance by strengthening weak organs and calming excessively hyperactive organs. Now let's examine the effects. The effects of Hwalbeop treatment vary according to the patient's condition, disease progression, age, constitution, etc. However, the general treatment process can be described as follows. 1. Acute diseases. Acute conditions such as acute lower back pain and acute gastritis often completely improve with 1 to 3 treatments. When energy stagnation is not severe and localized, immediate effects can be seen. 2. Chronic diseases. Chronic diseases that have persisted for several years require about 10 to 20 treatments. Usually, symptom improvement is felt between the first 5 to 10 treatments, and fundamental improvement is achieved through subsequent continuous treatment. 3. Incurable diseases. Diseases classified as incurable in modern medicine can also be treated with Hwalbeop, but considerable time and patience are required. Generally, 50 to 100 or more treatments are needed, and in some cases, several years of continuous treatment may be necessary. The important point is the starting time. Treatment must begin before the disease has progressed too far to reach an irreversible state. If continuous treatment is received according to Hwalbeop principles, all incurable diseases can be treated unless the starting point is too late. Chapter 5. Objective classification of practitioner levels and ability differentiation. Currently, objectively classifying the levels of Hwalbeop practitioners is absolutely necessary not only for academic purposes, but also for patient safety and treatment effectiveness. This classification can be systematized based on the Dreyfus model of skill acquisition as follows. First, novice practitioners, novice level, less than 3 years. Practitioners at this level use rule-based approaches. They have memorized acupoint locations and can perform basic acupressure techniques, but lack contextual understanding. Their treatments are essentially mechanistic manipulation, with no understanding of qi dynamics. Therefore, they can perform basic acupoint locations and acupressure techniques, but deep energy diagnosis is difficult. Treatment at the level of simple symptom relief is possible. At this level, only simple symptom location matching approaches are possible. For example, if there's a headache, they only stimulate acupoints in the head area. This is essentially no different from Western medicine's reductionist approach and is distant from Dongbang Hwalbeop's holistic paradigm. Second, intermediate practitioners, advanced beginner, 3 to 10 years. At this level, limited pattern recognition becomes possible. Treatment by meridian is possible based on basic understanding of the 12 meridians, but understanding of the 8 extraordinary vessels or complex qi interactions is still lacking. They have the ability to apply textbook knowledge to clinical situations, but haven't yet reached intuitive understanding. Therefore, treatment by meridian is possible based on understanding of the 12 meridians. effective treatment for general diseases is possible. The limitations of intermediate practitioners become clear when dealing with complex chronic diseases or multiple knot patterns. They try to treat individual symptoms separately and lack the perspective of overall energy pattern readjustment. Third, advanced practitioners, competent level, 10 to 20 years. At this level, true clinical reasoning becomes possible. They can comprehensively judge the patient's overall condition, set priorities, and establish systematic treatment plans. They understand the dynamic relationships of yin-yang and 5 elements and have the ability to apply this to actual treatment. Therefore, they can handle complex chronic diseases and comprehensively judge the patient's overall condition to establish systematic treatment plans. Advanced practitioners are proficient in pattern differentiation and can use different approaches according to the patient's constitution and situation, even for the same symptoms. They show adaptive expertise to detect subtle changes appearing during treatment and adjust treatment direction in real time. Finally, master practitioners, expert level, over 20 years experience and reaching the pinnacle of Hwalgeop martial arts. Here we must state emphatically, to become a master practitioner, simply having over 20 years of experience is absolutely insufficient. This is a level possible only for those who have reached the pinnacle of Hwalgeop martial arts. Practitioners at this level show intuitive expertise. They don't rely on explicit rules or conscious reasoning, but immediately grasp the core of problems through holistic pattern recognition. This is similar to how chess masters grasp board situations at a glance. Therefore, intuitive diagnosis and treatment are possible, and even the most complex and difficult diseases can be treated. To reach this level, one must achieve the pinnacle of Hwalgeop martial arts. Master practitioners can perform advanced techniques such as Qi-blood communication method, knot meridian tracing method, and yin-yang harmonization method, and sometimes show the ability to treat using Qi with just light contact. This is a phenomenon similar to quantum entanglement, which is difficult to fully explain with current scientific paradigms. At this point, we must directly confront the most serious misunderstanding of our time. We must clearly state that true Hwalbeop treatment is impossible without training in Hwalgeop martial arts. The internal energy and Qi sensitivity developed through martial arts training are essential elements of Hwalbeop treatment. This is not simply an additional ability, but means the ability to directly experience and manipulate the existence of Qi. Practicing Hwalbeop without martial arts training is like someone who only knows music theory but can't play an instrument trying to perform. Currently, other fields in the medical world are borrowing and using some techniques of Hwalbeop, but they all lack this martial arts foundation. Therefore, what they do is merely imitating the external appearance of Hwalbeop, and cannot be called true Hwalbeop. This is not simply a dispute between schools. This is a matter of academic accuracy and patient safety. Inappropriate use of techniques can cause not only lack of therapeutic effect, but also unexpected side effects. Chapter 6. Critical Analysis of Hwalbeop Misuse in Modern Medical Practice. Analyzing cases where Hwalbeop is currently introduced and used in traditional Korean medicine. Most are mechanically approaching from the extension of traditional acupuncture and moxibustion treatment. They focus only on external similarities of acupoint stimulation, but don't understand Hwalbeop's unique philosophical foundation and energy dynamic principles. Particularly problematic are attempts to understand Hwalbeop through the paradigm of acupuncture and moxibustion. While acupuncture aims for homeostatic regulation through meridian stimulation, Hwalbeop pursues energy transformation through direct manipulation. This is fundamentally different treatment philosophy, not simply a difference in tools. An even more serious problem is that some traditional Korean medicine doctors practice Hwalbeop without sufficient training, while packaging it as if it were a variation of existing tuna manual therapy or Doin angiotherapy. This is clear misrepresentation and causes confusion for patients. There are attempts in the physical therapy field to introduce some techniques of Hwalbeop as a form of manual therapy, but this contains even more serious problems. The basic paradigm of physical therapy lies in correction of biomechanical dysfunction, which is a completely different perspective from Hwalbeop's energetic rebalancing. Analyzing the so-called Hwalbeop techniques used by physical therapists, these are essentially variations of myofascial release or joint mobilization. They approach from a purely mechanical perspective, completely excluding the concept of qi, which completely distorts the essence of Hwalbeop. Even more problematic is that they try to explain Hwalbeop's effects as results of simple physical stimulation under the name of evidence-based practice. This is a reductionist error, like trying to explain the beauty of a symphony only through the physics of sound waves. In the chiropractic field, there are also attempts to use some techniques of Hwalbeop as complementary methods to spinal manipulation. However, their approach focuses on structural realignment and completely ignores Hwalbeop's energetic dimension. The Hwalbeop used by chiropractors has essentially been transformed into a type of soft tissue technique. They approach only from biomechanical perspectives of joint dysfunction and muscle imbalance, but don't understand the core concepts of Hwalbeop, qi circulation and knot resolution. Even more serious is that some chiropractors claim to have obtained Hwalbeop certification through several weeks of seminars or workshops and are performing treatments. This is an act that seriously insults the expertise of Hwalbeop, which is based on decades of martial arts training and philosophical understanding. Currently, one of the most serious problems in the market is the commercial abuse of the name Hwalbeop. Many companies are attaching the name Hwalbeop to simple massage or acupressure techniques for marketing, causing serious confusion for consumers. Particularly problematic are attempts to popularize Hwalbeop through franchising. They claim to train Hwalbeop specialists through short-term education of several months, completely ignoring the traditional master-disciple transmission system. This seriously simplifies the depth and complexity of Hwalbeop, and consequently increases the risk of reduced therapeutic effects and side effects. Furthermore, some companies use terms like scientific Hwalbeop and modern Hwalbeop while disparaging traditional Hwalbeop as outdated and unscientific. This stems from ignorance about traditional knowledge systems and shows the limitations of Western-centric thinking. Chapter 7. Importance of choosing the right practitioner and practical advice. Now I would like to offer practical advice on how to choose the right practitioner for those who wish to receive Dongbang Hwalbeop treatment. Choosing the right practitioner is very important as it has a decisive impact on treatment effectiveness. Understanding the practitioner's experience and training background is the first step. Simply having worked for several years is not sufficient. You must confirm from whom they learned, what tradition they inherit, and whether they received formal transmission. True Dongbang Hwalbeop has traditions passed down through generations. It's important to find out what lineage the practitioner belongs to and the reliability of that lineage. There's a world of difference between attending short-term workshops or seminars and formally establishing a master-disciple relationship and training for a long time. Whether they have experience in Hwalgido martial arts training is also an important criterion. As mentioned earlier, true Dongbang Hwalbeop cannot be separated from Hwalgido martial arts. Without martial arts training, one cannot properly handle qi, and without handling qi, true Hwalbeop treatment is impossible. Evaluating the practitioner's philosophical understanding is also important. During the initial consultation, observe what perspective the practitioner uses to view the patient. If they only ask about symptoms and try to treat only the corresponding area, they are likely at a novice level. On the other hand, if they comprehensively ask about the patient's overall lifestyle patterns, emotional state, constitutional characteristics, family history, etc., and try to find the fundamental cause of symptoms, they are likely advanced practitioners. Whether their explanations of yin-yang 5 elements theory or meridian theory are systematic and logical is also an important criterion. If they can explain these theories in ways patients can easily understand, they likely have deep understanding. Confirming the level of diagnostic ability is also important. Particularly, pulse diagnosis ability is an important indicator for judging practitioner level. Check whether they can accurately grasp the patient's condition through pulse examination and whether their explanations match the patient's actual symptoms. Skilled practitioners can discover symptoms the patient hasn't mentioned through pulse diagnosis. For example, they can make accurate observations like, "You have poor digestion, don't you? It seems you can't sleep well," or "You're under a lot of stress." Knot diagnosis ability is also important. Check whether they can accurately locate what types of knots exist in which parts of the body. Advanced practitioners can find the cause of problems in areas the patient didn't expect. Evaluating the systematicity of treatment approach is also necessary. Check whether the treatment plan is systematic and logical, and whether it aims for fundamental constitutional improvement rather than merely symptom relief. Novice practitioners mainly take an approach of treating where it hurts. Intermediate practitioners perform treatment, including related meridians. However, advanced practitioners establish integrated treatment plans considering whole body balance and the patient's overall health condition. Whether treatment goals are clear and staged, and whether expected treatment duration and frequency are reasonable, are also important criteria. Indefinitely long treatment or treatment without specific plans is not desirable. Observing the practitioner's character and attitude is also important. True healers are different from the very attitude of treating patients. Observe whether they truly listen to patients, empathize, and treat them with warm hearts. Whether they have the humility to acknowledge their limitations and refer to other specialists when necessary is also important. Exaggerating that they can treat all diseases or unconditionally denying modern medicine is not desirable. Check whether they answer patients' questions sincerely and explain treatment processes transparently. Mystifying treatment content or handling it secretively should be avoided. Checking treatment environment and facilities should not be overlooked. Check whether the treatment room is clean and organized, maintains appropriate temperature and humidity, and ensures privacy. Whether tools used for treatment are cleanly managed, and whether disposable items use new ones each time is also important. Confirm whether basic hygiene protocols for infection prevention are being followed. Checking other patients' reviews and reputation is also helpful. However, it's better to focus on specific treatment experiences and effects rather than simple satisfaction. Particularly, hearing treatment experiences from patients with similar symptoms to yours is useful. However, since there are individual differences, don't expect necessarily the same effects for yourself just because others had effects. Reviewing the reasonableness of treatment costs is also necessary. Both excessively expensive and excessively cheap cases should be cautioned. Judge whether it's at an appropriate cost level and reasonable compared to treatment content. Above all, treatment quality should take priority over cost. Receiving treatment from a skilled practitioner, even if slightly more expensive, can be more economical in the long run. Continuous evaluation during the treatment process is also important. Even after starting treatment, continuously evaluate the practitioner's skill and sincerity. Check whether treatment effects appear, whether they accurately grasp patient condition changes, and whether they adjust treatment methods as needed. If there are no effects after several treatments, or if conditions actually worsen, consider changing practitioners. Continuing to receive treatment that doesn't suit your constitution is not only a waste of time and money, but can also be harmful to health. Confirming emergency situation responsibility is also important. Since unexpected reactions can appear during treatment, check whether the practitioner has the ability and experience to appropriately handle such situations. How their cooperative relationship with modern medicine is also important. Check whether they have an open mindset to recommend hospital treatment when necessary, and what their position is on concurrent treatment with other therapies. There are also special precautions. For pregnant women, children, elderly people, and chronic disease patients, practitioners must be chosen even more carefully. Check whether they have sufficient treatment experience in such special situations and adequate knowledge about safety. Furthermore, for mental problems or serious diseases, there may be limitations with Dongbang Hwalbeop alone. In such cases, it's important whether the practitioner has the judgment to acknowledge their limitations and refer to appropriate specialists. I'll suggest specific methods for finding trustworthy practitioners. First, it's good to receive recommendations from professional institutions or organizations. Practitioners recommended by traditional Korean medicine associations, traditional medicine-related academic societies, martial arts organizations, etc., often have skills above a certain level. Practitioners active in university hospitals or traditional Korean medicine hospitals are also relatively trustworthy. Such institutions require certain qualification standards, so basic safety is guaranteed. Recommendations through word of mouth are also useful. Testimonials from people who have actually received treatment are very important information. Particularly, recommendations from people who received treatment for a long time and saw good effects are trustworthy. Internet searches are also helpful, but you must judge the reliability of information well. It's better to avoid places that advertise excessively or claim exaggerated effects. Finally, the patient's own preparation and attitude are also important. Dongbang Hwalbeop is a healing process created together by practitioner and patient. Good results can be obtained when patients actively participate and have the will to improve their lifestyle habits. Also, having patience and receiving consistent treatment is important. For chronic diseases, complete cure is difficult in a short period, so treatment must be approached from a long-term perspective. Communication with the practitioner is also important. You must accurately convey your symptoms and condition and honestly discuss changes felt during the treatment process. This information is important help in determining treatment direction. Please consider all these factors comprehensively and carefully choose a practitioner. Meeting a good practitioner is the first step and most important factor in health recovery. Conclusion: the new direction of medicine presented by Hwalbeop. As we conclude our journey, it's time to draw clear conclusions about the ontological identity and modern status of Dongbang Hwalbeop. This is not merely academic organization, but an important declaration that determines the future of this unique traditional medical system. Dongbang Hwalbeop is not simply a treatment technique. It is a medical system that presents a completely new paradigm for human health and disease. For complex and chronic diseases rapidly increasing in modern society, it provides fundamental solutions that existing Western medicine cannot offer. This is a unique medical paradigm based on Qi philosophy, with fundamentally different ontological foundations from Western reductionist medicine. This identity is defined by absolute principles that cannot be compromised. First, the inseparable relationship with Hwalgido martial arts exists. This is not an option, but an ontological necessity. The Qi sensitivity and energy control abilities developed only through martial arts training are prerequisites for true Hwalbeop treatment, and all treatments lacking this are unqualified to use the name of Hwalbeop. Second, it has characteristics as holistic energy medicine. Hwalbeop pursues optimization of whole-body energy circulation, not local symptom treatment. This is an integrative approach fundamentally different from modern medicine's analytical approach, and all approaches ignoring this characteristic distort the essence of Hwalbeop. And third, it has identity as personalized constitutional medicine. Hwalbeop doesn't rely on standardized protocols, but pursues customized treatment suited to each individual's unique constitution and condition. This is a much more comprehensive and deep personalization approach than precision medicine. What must be emphasized here is that we can no longer show tolerant attitudes toward the misuse and abuse of Hwalbeop currently occurring in the medical market. This is not only a matter of academic accuracy, but also of patient safety and traditional knowledge protection. First, Hwalbeop. Treatment without martial arts foundation is clear misrepresentation. This is dangerous behavior, like teaching physics without mathematical foundations or performing surgery without anatomical knowledge. We must clearly express opposition to such behavior. Second, abuse of the Hwalbeop name for commercial branding is also a serious problem. Attaching the name Hwalbeop to simple massage or acupressure techniques is consumer deception and insult to traditional knowledge. Legal and institutional responses are also necessary for this. And third, specialist training programs through short-term education seriously simplify the depth and complexity of Hwalbeop. Claiming that advanced skills requiring decades of training can be acquired in several weeks or months is unacademic and unethical. In conclusion, what's important in the relationship between Dongbang Hwalbeop and modern medicine is equal partnership based on mutual respect. Hwalbeop should not fall into a supporting role for modern medicine, and true integration, recognizing each other's unique values and domains, should be achieved. For this, the perspective of epistemological pluralism is needed. Wisdom is needed to recognize that different medical systems deal with different aspects of the same reality and to choose the most appropriate approach according to situations. In acute diseases or emergency situations, rapid and accurate intervention of modern medicine is necessary, while in chronic diseases or constitutional improvement, Hwalbeop's fundamental and holistic approach may be more effective. Such role division and mutual complementation is the true appearance of integrative medicine. Dongbang Hwalbeop is our nation's precious cultural heritage and a unique knowledge system that can contribute to human medical history. However, such value is not automatically preserved or developed. Our active and continuous efforts are needed. As the maxim, "A sound mind dwells in a sound body," suggests, healthy individuals gather to make a healthy society, and a healthy society guarantees a healthy future. Dongbang Hwalbeop is a precious resource that can contribute to realizing this vision. But most importantly, we must humbly discover and utilize the healing abilities God has given to humans. As stated in Exodus 15:26, "I am the Lord who heals you." The source of all healing lies in God the Creator, and we must fulfill our stewardship mission of caring for each other through the wisdom He has permitted. The greatest value of Hwalbeop is that it views humans as one complete energy system and pursues fundamental healing through holistic approach. This is not symptomatic treatment that merely suppresses symptoms, but recovery of the ability to become healthy by maximizing the body's natural healing power. Particularly, diseases considered incurable in modern society can be treated according to Hwalbeop principles through consistent treatment, unless the starting point is too late. This presents new hope to many patients who have received desperate diagnoses. However, to obtain such effects, one must receive true Hwalbeop. Fundamental therapeutic effects cannot be expected from fake Hwalbeop that merely imitates techniques without martial arts foundation. Patients must accurately grasp practitioners' backgrounds and abilities to find true Hwalbeop specialists. Hwalbeop is not a relic of the past. Rather, it is future medicine that presents the most advanced answers to health problems faced by modern society. It is a completed medical system that has already realized all values pursued by modern medicine: personalized treatment, prevention-centered medicine, safe treatment without side effects, holistic approach for thousands of years. I hope that more people will understand the true value of Hwalbeop in the future and choose Hwalbeop for healthy living. And through this, I hope for a world where everyone can enjoy healthy and happy lives by fundamentally solving the prevalent diseases of modern society. Most importantly, we must humbly discover and utilize the healing abilities God has given to humans. The source of all healing lies in God the Creator, and we must fulfill our stewardship mission of caring for each other through the wisdom He has permitted. Hwalbeop is one tool for realizing this sacred mission, and I hope that through this, many people can recover their health and realize the preciousness of life. Thank you for being with us for this long time. I hope this content will help your healthy living and academic exploration. And if you want more in-depth content, please join our continuous learning journey by subscribing to our YouTube channel.